Hi, everyone. This is Pat Chibbaro, and I'm really excited to be the multimedia specialist, the podcast editor for the Cleft Palate Craniofacial Journal. I've been away for a little bit. We took a little summer sabbatical, but we are back, and I'm really excited to present this terrific paper to you. And actually, this is a paper that we actually tried to record during the ACPA meeting, but we were all in the room together and it didn't work. So we had a good practice, right, ladies? We had a great practice. So let me introduce this paper to you, and you can find it online first, and it came out May 29th, 2023. And so a little hint is when you go online to the journal site, search on online first to page 5, and the paper is right there. So make it easy for you. The name of the paper is Establishing an International Interdisciplinary Research Network in Craniofacial Microsomia, the CARE program. And for anyone who was at the ACPA meeting, they were walking around with those CARE buttons on. I still have my CARE button, so I'll always remember. So, and there are multiple authors, which I think is just always wonderful, and the authors are from all over the world because Nicola is from Bristol. So it is Dr. Nicola Stock from the Center for Appearance Research, University of West England in Bristol. Kenise Creran, who is a psychologist at the Center for Biobehavioral Health Nationwide Children's in Columbus. Alexis Johns, Dr. Johns is a psychologist at Children's Hospital in LA. Christy McKinney, who is a psychologist working in Seattle Children's Research Institute. Martine, I'm sorry?
She's an epidemiologist.
Oh, an epidemiologist, sorry. Yeah. And Martine Akudstal, who I believe is a surgeon.
Yes.
And in Rotterdam, an oral maxillofacial surgeon. And Dr. Amelia Drake is an otolaryngologist at Chapel Hill. And last but not least, my friend, Dr. Carrie Heike, are you a developmental pediatrician or pediatrician?
I am a craniofacial pediatrician.
There you go, from Seattle Children's. So first of all, I think my first question to you both, first of all, thanks for being with me again.
Second time lucky.
Second time's a charm. But how did this group, this very varied group from different disciplines, which I love, so emblematic of the ACPA, how did you guys all get together?
I feel, Carrie, you should field this one because I feel like you were the main driver in the very beginning, and then I kind of just jumped on board the train. So,
well, as you say, it was kind of an organic meeting of the mind. So a lot of the individuals on there in this group were experts in their own field, doing their own research, and really innovative and important research in the area of craniofacial. And as we were looking for, my area of focus really was focused on craniofacial microsomia. And so as we were looking ahead about how are we going to develop the next projects, the next grants, really address the questions that are most important to the larger community, it really became clear that partnering and this concept of team science and really bringing in the expertise of all of these unique individuals and their academic interests into one combined cohort and tapping into the potential for synergy across groups. And then with that, expanding. So we started with this core group of people, developed the grant, and then once we were able to launch the grant, we could really open up the community. And our hope is to continue to grow.
So then the motivation, where the motivation come from? Was it really from that Carrie, you really were focusing on craniofacial microsomia and and that's where the motivation was? Or I know when we're at ACPA meetings together, we often we do a lot of good work at the bars, you know that. And that's where we come up with a lot of projects. And I was thinking, I saw this group and I know them, I mean, I don't know everyone, but this is a superpower of people who have worked, especially in the psychosocial area for many years. So I was wondering, where that motivation came from. And Nicola, you said you jumped on the train. Where did you jump? When?
It was a few years ago, wasn't it, Carrie? I think we met at one of the Appearance Matters conferences in Bristol. And I think we found we had a lot of shared interests And it kind of grew from there. And some of us have worked together before, and for some of us, we kind of never met before. So it was a bit of an interesting jump. But I think we can now, almost 4 years in, very safely say that we have a very solid and very fantastic crew.
Yeah.
Oh, you absolutely do. You absolutely. I mean, I just saw the list and I thought, wow, this is a powerhouse. And I mean, for anyone that's read the journal over the years and have come to the meetings, this is a really dedicated group who have multi-published, and I was really glad to see this. And just wanted to jump back to the diagnosis that you're looking at. And as we know, I mean, besides cleft lip and palate, it really is the most common, craniofacial diagnosis. Maybe just clarifying craniofacial microsomia, because in my 34 years of taking care of these kids, there were so many different diagnoses. And I remember when I first started, it was hemifacial microsomia, and Dr. McCarthy, my director, used to say, no, it could be bilateral, so it's craniofacial microsomia. And then you started to see the language change, and then you saw the variants like golden heart syndrome. So I wonder if we could talk a little bit about, let's just really start talking about this, this program and what it was that you wanted to do. And maybe, I know Carrie just talking a little bit more about the diagnosis, if you wanted to start with that.
Yes, absolutely. So you asked a little bit about the motivation for this work, and I would say for me personally, I'm a pediatrician on a large craniofacial team, and as you mentioned, one of the things I love most about our work is this ability to collaborate with all the subspecialists and really work together, viewing the healthcare needs of children from different perspectives and figure out in partnership with the family what's best for the child. And I think what I appreciated in the beginning was how difficult that was for children with craniofacial microsomia. And there's a lot of reasons for that. One is each child is unique. The way in which the condition affects each child is unique, and what their wishes are unique. And so you see a tremendous amount of variability. And so part of the goal then is to figure out, how do we help navigate that? How do we help figure out what are the things that all children deserve and need and should be standards of care? What are the things that are more optional? And how do we advance the field so that we can make sure that we're continually improving care and what we can offer for families? And so with regard to the name, this is an area that we struggled with a lot with this interdisciplinary group. We also have 2 patient advocates who are phenomenal and huge contribution to our advisory council. And names mean a lot to people for good reason. It gives you a sense of community. It gives you a place to go to search out information. And so people are using a lot of terms. But from a research perspective, what we care about is making sure that we understand who the population is that we are working with to improve care. And so our philosophy was, if you have a known diagnosis like Treacher Collins, there's more likely to be a path that is typically followed for care. For kids with craniofacial microsomia, it's less clear. It's a lot more variable. And so we don't think that it's necessarily the right term or the most accurate term, but it's the term that we use as an umbrella term that captures whether or not you identify as having golden heart, OAVS, hemifacial microsomia, microtia. We want to do research and advance the clinical care for kids that fall under that umbrella.
Mm-hmm.
It's a big undertaking, and but when you have this amazing group, and I think you're going to accomplish so much with really making it such a diverse group around the world. I really would love, Nicola, if maybe we could talk a little bit to give people an understanding of the program, because it's developing. I mean, you've been into it for a few years now, correct?
Yeah, that's right. Yeah.
So maybe we can, and I do have the ability to, for those who are watching this in the video, to share my screen, and I have your paper. So let me know when you want me to put that up. I'm happy to do that for you.
That would be great. Thank you. Yeah, to give those who have the means a bit of a visual as well while we're talking about this. But I guess just to jump onto your question first, Pat, about motivations, because I think for me, I've been working a lot in cleft lip and palate when I met Carrie around maybe 6-7 years ago. But I was very conscious that there are these other, much rarer conditions out there that maybe get less attention, but actually those groups are potentially more vulnerable because their conditions are more rare and more complex. So I was really lucky, really, and very enthusiastic to partner with Carrie and to kind of bring my expertise around trying to understand the psychosocial impact of these conditions and people's treatment experiences. And then how do we kind of pull all of that amazing information together so that we can hopefully improve care in the longer term.
And I think you're right. One of the challenges with this condition is the range of severity. And you're right that it really encompasses, such a range. And one of the things that I found was where we would sometimes have the assumption that if we thought that the condition was mild, so for example, if maybe they had just a microtia, that, I think about the psychosocial impact. Well, they're so lucky because they don't have, the extent that other kids do. And I think that's one of the things as clinicians from your program, when you start to really be able to develop an understanding of what their individual psychosocial challenges are, that we as teams can better help them. So that's just one thing I was thinking about. And the other thing I was thinking about before you show us the program was the whole idea of whether or not we should be, quote, pushing children to have surgeries that maybe aren't, for medical functional reasons, but more for psychosocial functional reasons. And I got a lot of this from a meeting from the ACPA meeting where there were adult patients talking about their conditions. I don't know if you were there, but it was so impactful for me because, we as the clinicians are trying to support the parents who want everything to be done for their kids. And then as the kids get older, there are some who would say, well, I don't want to have my ear done. I'm okay with the way I look. So I'm hoping that as you develop the program, you start to identify some of these things that we as the clinicians could help with. So I was really excited about that. So I just wanted to throw in some of my own thoughts, just reading about what you're going to do and looking forward to what the data that you get that's going to help us. So thank you from all the clinicians. Yeah. So do you want me to share the screen now so you can see the aims of your program? Would that be cool? Okay, it's very exciting for me because anyone who knows me knows I'm completely non-tech oriented. And I'd like to thank my daughter for helping me with this. Okay, so here I am. Can you see it?
Yes.
Yes.
This is very exciting. All right, Nicola, take it. It's all yours.
All right, here we go. So I'm gonna rattle through these amazing big studies that we've got. We crammed in 4 very large and complex studies into this 5-year program. And as we say, we're about 3.5 years in now. So the first aim was really about hearing from the community. We wanted to hear people's stories. So we reached out to caregivers of children aged 3 to 17, and we asked them to tell us their stories. And then we also reached out to adolescents aged 12 to 17, and then young adults, which we defined as being aged 18 to 45. And we asked them to take part, first of all, in a medical history interview so we could get a better understanding of the history in terms of what medical interventions they'd had. And then we asked them to take part in a separate narrative interview, which is a really interesting method. So we asked the participant to divide their story into chapters as if it were a book, and then to tell that story chapter by chapter. So they were really able to guide the content of the interviews as opposed to us deciding what the questions were going to be. The interviewer could then follow up with any prompts if they wanted to clarify anything or maybe elicit a bit more information. And then we asked each participant to identify a high point, so something that was particularly memorable in a positive way, and also a difficult point in that chapter, a low point, so something they found particularly difficult or challenging. And so that was the structure we went with for the interviews, and it was really rich. I mean, some of these interviews are over 3 hours long.
Wow.
we've got over 200 hours of interviews in total. And we managed to interview, I think it was 108 interviews in total. So that's caregivers, adolescents, young adults, and then we also did some interviews with Spanish-speaking participants as well to try to capture that diversity too. So we've now preliminarily analysed all of that information, pulled it together into some frameworks, which are going to guide the rest of our work. So we use the information that we gained from those interviews, and we put that into an international online survey, which is our aim 2, and that is currently recruiting. So we are hoping to recruit around 300 individuals with CFM and 500 caregivers. And we are trying to recruit from 5 different countries. So we don't do things by halves. So that's the UK, the US, Canada, New Zealand, and Australia. And we're hoping to also roll out the survey in Spanish as well down the line. So that's currently recruiting, and what we really want to do is to understand on a much bigger scale and on an international scale what might be the different factors that help us to explain why somebody might cope well with this condition and why some people might struggle. And that will give us some really useful and rich information about where we need to potentially intervene in the future. I'm going to pause there because I wonder, Carrie, if you'd like to do aims 3 and 4.
I'd be happy to do that. I think the other thing I just wanted to point out is we haven't ever conducted a study prospectively with a sample size that large, that many participants. So we're really excited to hear from a broader community. And one of the things that's been really important to the group too is to not focus solely on children who maybe have care at specific ACPA approved teams, because we really wanted to understand the holistic experience for those that may not have access to teams as well. And so part of our goal is to really expand the reach, which can be really challenging for children with rare conditions. And so we're hoping to leverage the community to help us do that and to really get a broad set of feedback from those who would be interested in participating. So for the last 2 aims, we knew that it was really important, obviously, to understand from the caregivers and the children their perspectives and their experiences and where the gaps are and where the opportunities are. But we also wanted to make sure that we were hearing from the healthcare providers. Just as you had spoken about, Pat, a lot of the motivation for this work came from our healthcare provider community and where they were seeing the gaps. And so now, armed with this information from the patients and families, we wanted to go back to the healthcare providers and understand a little bit better about how they view some of these themes that have come up from the from the patients, and then also where they see the opportunities. What are the kinds of interventions or opportunities do they see that we could be providing better psychosocial and eventually healthcare for this patient population? And so
Carrie, so are you going to be, I know that you had reached out to me to get, some volunteers for nurses and coordinators. Will it be providers from different specialties as well?
Yes. So we're looking to include at least 50 healthcare providers across specialties. And again, we're trying to tailor it to the kinds of providers that typically are involved in the care for kids with craniofacial microsomia and prioritize a number of interviews per subspecialty, depending on how frequently kids would likely be to interact with someone from that subspecialty. And then we're trying to do the same thing in terms of breadth and scope. So we really want to make sure these are healthcare providers who have experience caring for children with CFM and are able to meaningfully contribute to the next phase of identifying these opportunities. But we want to make sure that we're geographically represented, that we've got the subspecialty representation, maybe the level of experience, how long people have been in practice, to capture those changes and trends over time. And we also wanted to interview the healthcare advocates. And so we've got some fantastic advocacy organizations that have been fundamental to the work that we're doing and helping engage the community, advertise the opportunities, and then help inform us about where we need to go with the future research. And so that they will be incorporated into this next phase of the interviews. And then hopefully at the end of the grant, we're synthesizing all of that information and we'll come up with some clear next steps for the many ways in which we can offer interventions in the care pathway for children with CFM. And then last but not least, we also know for any rare condition, having a cohort, a population of individuals is really critical to advancing the field. And so it's been a challenging task to try to figure out how best to do that for this group, as we talked about, very diverse needs, very diverse ways in which kids are impacted, but starting with just a registry and understanding who is part of the community, who's interested in being in future research, what are the questions that we've addressed that resonate with people, what are the questions that have not been raised that are important to people, and starting to create that community. And that's the overall theme that we've heard from many of the interviews is we need community. We would like a shared space to have conversations about these important psychological and healthcare needs of our kids and of our families and ourselves. And so the registry is serving that function. We're not live yet with the registry because we really wanted to start the survey process first. But our hope is, again, that this is something that will continue to grow and expand and be useful for a lot of different individuals who want to launch research programs in the future, specific questions that come up, give us populations that are interested in participating. And then a key theme of all of the work that we're doing is we want to make sure that anything we learn is accessible to people. So giving back to the community, taking some of the publications that have been created and putting them into patient-friendly formats, giving people good information that's been vetted by experts in these fields to help synthesize information and make it accessible.
Wow, you and you talked about challenges. So I thought, Nicola, before we started, we were talking about challenges. And so what challenges have you found, in this journey that you have, taken on, which is incredible?
Yeah, we, as you can imagine, kind of assembling a team of this kind of scale with a project of this scale has brought many challenges. Of course, like in every other study, COVID-19 was a consideration for us. We started in May 2020, so right in the thick of it. But I think because we'd assembled this international team, we knew that we would have to work remotely for the majority of this grant. So we had kind of those things in place. We were very keen on team science principles. So we did, lots of retreats together, kind of online, of course, but so for everybody could get to know each other really well and to kind of learn about different people's communication styles and information preferences, where everybody's expertise lay, so that we could combine those expertise to the best of our ability. So we did a lot of work in the beginning to kind of build that network and build those relationships, which I think stood us in really good stead. I think one of the other challenges that we had is attaining broad participant representation. So as Carrie's alluded to really beautifully, this condition is really broad and very complex, and there's a spectrum, if you like, where people fall. So we really wanted to make sure that our participant group was representative of the full spectrum. So we did a lot of work around that. And for example, we kept a really good track of all the demographic variables. We regularly assessed the representativeness of our sample. And then we were able to specifically target any groups for where the numbers were lacking slightly. So we did a pitch for fathers, for example. We did a pitch for kind of the more medically complex families as well. And I think that that kind of approach really worked, as well as just continually seeking advice from our advocacy groups as well.
Great.
Carrie, did you have any other challenges that you wanted to share, or is that plenty?
No, I think that's plenty. I think your point about team science is is really key. And I did want to acknowledge we did have some help with that. So I think as ACPA members and as members of teams, we're very good at interdisciplinary collaboration as a principle. But it was also really helpful for us. We had support from our Institute for Translational and Health Sciences, who provided some more structured team principles in communication. And so when we're using the same words, we might have different meanings. And so just really learning to break that down, especially when we're partnering with families and caregivers and advocacy group members, and then even across disciplines. When I use the term that I think is very intuitive, it could have a totally different interpretation for someone else. And so I've been very humbled by that, because in order to really maximize everyone's ability to participate and contribute, it does take a dedicated effort to breaking down those communication challenges.
So it sounds like among next steps are to get our big ACPA community involved.
Yes.
Yes, this is a call to action, everyone.
Go for it. Here's your chance to pitch it out to this amazing group. And I think, getting this out here in the podcast, I think also posting it on the online communities, I think so many of us would be happy to help. There's so much knowledge in this group. I think once you start, recruiting, you're going to get some good response. People really, I think it's exciting to feel that we, as the healthcare providers can really be a part of your research. So I think that's, it's a great thing. So, anything you'd like to say to the people who are listening right now?
Absolutely. Yeah. So I think that's a really good moment to say, that Carrie and I are representing, the group here today. We've got, Pat, you named all the authors on the paper, but actually there's a much, much bigger team behind this. So we have the advisory council, we have a number of kind of subgroups as well that inform us. We have the advocacy groups. Everybody has been amazing and played a massive role in this work so far. So it's a massive community effort, and that's what we want to continue to do and to grow. So for those listening, I suppose, the minimum you can do is have a look at our website, because all of the information that you might want to know is there, and obviously our contact details are there. We would also really encourage people to get in touch if they're interested in collaborating, because we have that wealth of interview data that is going to keep us busy for years. So if anyone's interested in having a look at that and having conversations with us about how we could collaborate, we're very open to that.
And what is the site?
The website. Yes. So it's thecarestudy.org. Okay. Thanks for testing my memory there. And then, for AIM2, our surveys, we would absolutely, as we mentioned, love to get representation of caregivers and individuals from across the world involved in this, and to have their voices represented as well, and their experiences be part of this work. So anyone who has the ability to share that survey, we'd be extremely grateful with your own communities, wherever you are. And then in terms of AIM3, Carrie, do you want to pick that one up?
Absolutely. So Pat, you so nicely summarized. We would love to embrace the ACPA community for AIM3 and healthcare advocacy groups. I also just wanted to speak to Nicola's point. So everyone in this team is interested in education training of the next generation of scientists as well. And so I really encourage, I'm standing on the shoulders of people who came before me at ACPA and have conducted really high quality research. I know there's a lot of specific projects that people are focused on and in the area of treatment for craniofacial microsomia. And so again, just not being shy about reaching out and connecting and seeing if there's a way that we can help support the next generation of scientists.
Fantastic.
And then finally, Pat, one more. One more is that we Carrie mentioned the registry, and we're trying to, as you mentioned, Pat, build this community of people who are interested in CFM and kind of want to do work in this area. So signing up to the registry is a really good starting point. And you can also access our newsletters and other bits of information that we're putting out as well. So if you want to, you know, just kind of stay on the sidelines, but you want to stay up to date, then that's a good approach.
There you go. And so I'm really excited to, once again, let me just read this paper to you. It is Establishing an International Interdisciplinary Research Network in Craniofacial Microsomia, the CARE program. The authors are, you know, it's a superstar group. And in addition to these authors, so many other people who have been involved, but it's Nicola Stock, Kenise Creran, Alexis Johns, Christine McKinney, Martine Kudstall, Amelia Drake, and Carrie Heike. And thank you to my friends, Nicola and Carrie, for joining me today. This time, I think we've got it. We had a few technical but you can find this paper online first. And if you're sitting in front of your laptop, the way I found it was I searched and on page 5, there's the paper. So go right to page 5, you'll get it, you'll read it, and you'll want to help support this amazing program. To my friends who are with me, you know, thank you. And for anyone who's listening, you know, this is the kind of work that everyone can contribute to, and I think it'll help everyone be better, even better clinicians. So thank you, both of you, and to your whole team for this work, and we look forward to seeing more of it in the future. Thanks.
Thank you.
Thank you so much.